All right, we ready to rock? Ready? Okay. Thank you for being here. I'll have an opening and I'll pass it to Siobhán Vipond, Vice President for the CLC, and then we'll get into your questions at the end. Today's a historic day. For generations, yes. For generations, New Democrats have been fighting for universal pharmacare. Labor activists have been fighting for universal pharmacare. Health coalition activists have been fighting for this. And so today, I can say with a lot of pride, because of the hard work of so many union activists, because of health coalitions, because of the labor leaders that are behind me and the health coalition activists behind me, because of New Democrats, because of my team, and because of our health critics, both the previous health critic, Don Davies, and my current health critic, Peter Julian, and my entire team, my staff, everybody together, we are proud to say that today we will pass the foundation of universal pharmacare in Canada. Yeah. And in addition, we've also fought very specifically to make sure that people will have access to free birth control and free diabetes medication and devices. This will help millions of Canadians. And I want to tell you just two stories of what this will mean. I want to tell you two people on two ends of the spectrum. Rosemary, a young child of 4 years old, who was diagnosed at 1 year old as having type 1 diabetes, and Linda, who has lived her whole life with type 1 diabetes and now is a retired person living in Port Moody. For both of these people, I want to tell you what this means to have access to free diabetes medication and devices. For Linda, she calculated how much it costs her out of pocket just to stay alive, to buy her medication. And she says right now she's got some coverage as a senior, as a retired person. She's got some workplace coverage left over, as well as some coverage from the provincial government. Piecing it together, she still has to spend about $3,000 a year out of pocket. And then she says, throughout my life, I've had a flux of coverage. It's probably been a lot less in the past, so I've spent a lot more out of pocket. So over 40 years of having type 1 diabetes, she's spent over $120,000 out of pocket just to live. This is not a luxury. This is just to stay alive. And so for her, it would mean no more worries, no more anxiety of trying to piece together the coverage. Her medication will be covered, and she can live in dignity and respect. And for Rosemary, who's 4 years old now, she was diagnosed at 1 having type 1 diabetes. For her, what her parents say, when I spoke with her parent, Scott, for her it would mean a lifetime of not having to worry about getting that coverage. Not having to worry about have the right job that's got the right coverage. She can pursue her dreams. It would save money for the family right now, but it also would mean a brighter future for Rosemary for the rest of her life. That's why we fought for this. We want universal pharmacare for everyone, and we're starting with birth control and diabetes medication and devices. And we're proud of that. I want to be very clear, though. This would never have happened but for New Democrats and our allies forcing the government to do this. The Liberals voted against this just years ago. They've been promising this for 30 years and broken their promise. We forced them to do this. And the Conservatives are still opposed to it. They would take this away. They say that it doesn't matter, that it's not worth it to cover people who are living with diabetes or medication. They have opposed and have blocked bringing in free birth control. So let us be very clear. We are going to fight back against Conservatives, make sure this bill is passed today, and build on this so everyone in our country has access to free medication. I'm going to do that in French, and then I'm going to pass it to Siobhán Vipond. Donc, aujourd'hui, c'est une journée vraiment historique. On a forcé le gouvernement d'aller de l'avant avec ce qui aujourd'hui, c'est la fondation d'une assurance médicaments universelle pour les Canadiens. C'est quelque chose qui va sauver l'argent et sauver les vies. C'est vraiment fondamental et c'est quelque chose on s'est battu depuis longtemps. Et je veux aussi reconnaître le travail des syndicats et des coalitions pour la santé, le travail, grâce à tous ces gens, grâce à notre équipe. Aujourd'hui, on va passer ce projet de loi. Je veux remercier toute notre équipe, tous mes députés, tous les gens qui travaillent dans mon bureau, mais aussi en particulier, je veux remercier Don Davies et Peter Julian pour leur travail sur ce dossier. C'est clair que si les libéraux étaient laissés seuls, ils n'auraient jamais allé de l'avant avec ce projet de loi. On les a forcés de faire ça. Et plus, les conservateurs, comme ils veulent tout le temps, ils veulent couper cet avantage pour les gens et ils essaient de bloquer ça. Le Bloc et les conservateurs ont essayé de bloquer ce projet de loi, mais on n'a pas arrêté, on ne lâché pas et aujourd'hui, on va passer ce projet de loi. C'est vraiment fondamental pour un système de santé qui fonctionne de couvrir les médicaments. Donc, c'est ce qu'on a obtenu avec ce projet de loi. On va continuer de mettre la pression. On est fiers de notre travail. As I said, I want to give an opportunity for our labor allies to share their voice on this. And so I'm very, very proud to introduce to you a powerful voice for working people, Siobhán Vipond.
Hi everyone, I am Siobhán Vipond and I'm Executive Vice President with the Canadian Labour Congress, and I am honored to be here on this momentous day. Thank you to Jagmeet and the NDP who have made it so that we could be here to celebrate this big day, which is getting so much closer to us having this foundation of pharmacare in Canada. It's what we need. It's what workers have been fighting for. And we're only here because of the activism and advocacy of so many people. And we're here, and thank you to Minister Holland for working with the NDP as we were able to get to this point, because it is such an important issue to folks everywhere. We want to talk about, I remember when I was younger, I had a roommate who had, she had diabetes, but she made every decision on how she medicated herself based on the cost. And when you look at someone you're close to and see them nearly crying because the needle's dull as they jab it into their leg because they're just hoping they don't have to buy a new one right away because of the cost. That is not how things should be happening. And things haven't changed significantly. We have people and workers reaching out to us to say thank you, make sure this happens. We heard from Tina, who reached out because her mom, who's been working since she was 16 years old, has never had workplace coverage or has never had enough workplace coverage. And so she's constantly deciding whether she can afford her diabetes medication or afford the other things that you need to live in life. We heard from William, who talked about his partner. He's in a minimum wage job, yet is paying $200 a month just for the insulin. But there are so many costs associated with that. And when we talk about having access to free contraception in this country, we are talking about gender equity, and we should never forget that, and we should never underplay the importance of that. Decisions about your health should be a decision between you and your healthcare provider, not between you or your healthcare provider and your ability to pay. So we are here because we're in an affordability crisis for many folks, and programs like this will make a real difference on what it costs to live here in Canada. Programs like this, childcare, when we talk about dental care, this is what's going to put money back in people's pockets. And so I encourage everybody to vote in favor of this. I will call out the Conservatives who have been stopping it every step of the way, because this is good legislation and this is good for Canadians and it's good for workers. So today is a good day. Let's see it go through. And then to the Senate, this has been duly debated. It's been duly researched. Let's pass this quickly and deliver for Canadians. Thank you. I'm going to pass it to Anne from the Canadian Health Coalition.
We've got to get to questions because question period is starting in 5 minutes, guys. So
Okay, that's okay.
Okay, so I'll make it really short. Je suis venue à Ottawa au nom de la Coalition canadienne de la santé. My name is Anne Lagacé Dowson. Je tiens à saluer nos amis et alliés de la Coalition Solidarité Santé du Québec et leurs centaines d'organisations affiliées. Malgré ce que le Bloc dit, la grande majorité de la société civile du Québec appuie ce projet de loi. So when they say Quebecers don't want this, they already have coverage, it's not accurate. The vast majority of the civil society in Quebec wants this, as do Albertans, incidentally. So I encourage you to look behind the discourse that you're hearing from some of our federal politicians. I just want to say the Canadian Health Coalition was founded in '79 to defend and improve our public health care system. Our members are frontline healthcare workers unions, community groups, students, public health experts, and we heartily welcome the introduction of this legislation. We really, really hope that it'll go through. We encourage you to see who's behind us here. We have physicians for Medicare. We have all kinds of great supporters. So I know you're under a time crunch. I understand that. I know. So I'm going to stop talking. Yes. But just to say, this is not coming from nowhere. It's 30 years of work by activists, 3 decades of this. And this is what is required by a full coverage of health care. 1 in 5 Canadians are not covered.
Mr. Thanks so much.
This question is to you as a lawyer, sir. The Chief Justice held his annual news conference. He called out today many threats of criticisms against the judiciary and an increase in what he called the inaccuracy of court reporting. Do you have concerns about the Chief Justice's concerns and whether this will be affecting the integrity of our courts and how they are reported to Canadians in both languages? Please, sir.
I absolutely will take the Chief Justice's remarks and give them a lot of weight. If this is something being raised by the Chief Justice, I think we have to give it serious consideration. And if the Chief Justice is worried about the recording process or the reproduction of what's happening and its impact on the accuracy of what's being reported, that is something we should take seriously. Donc, si le chef des juges soulève des inquiétudes, je crois qu'on doit prendre au sérieux ces inquiétudes. Et si ça va avoir un impact sur la reproduction de ce qui se passe dans des cours, on doit prendre au sérieux ces inquiétudes.
Monsieur Singh, qu'est-ce que vous avez pensé des propos anti-avortement du député conservateur Arnold Wilson en fin de semaine?
Je pense que ça montre le vrai visage des conservateurs. J'ai dit qu'on doit regarder les actions des chefs du Parti conservateur aussi. Il s'est attaqué, il a essayé de bloquer les contraceptifs gratuits. Elle a laissé un député l'année dernière de déposer un projet de loi ou une motion qui attaque les droits des femmes. Elle a laissé ses députés assister à un événement contre le choix. Donc, c'est clair que les conservateurs et le chef Pierre Poilievre veulent attaquer les droits des femmes.
Le chef, lui, est clairement pro-choix. C'est sa position, il l'a exprimé souvent. Est-ce que ça ne vous suffit pas?
Non, pas du tout, parce qu'il dit une chose et fait l'opposé. Si on regarde son bilan, comme j'ai dit, il a essayé de bloquer les contraceptifs gratuits. Il a laissé ses députés présenter une motion anti-choix. Il a laissé ses députés assister à des événements anti-choix. Donc, ça montre clairement avec des actions que Pierre Poilievre est contre les droits des femmes et contre les droits de choisir.
On a entendu Mme Lagacé Dowson nous dire que le Bloc a tort, dans le fond, avec son argument sur les champs de compétences. Mais quand Québec solidaire vient lui aussi avec ce genre d'argument-là, croyez-vous que c'est un parti qui est progressiste?
Je pense que ce que Mme Lagacé a soulevé, et c'est quelque chose qu'on a essayé de présenter, qu'il y a une grande majorité des sociétés civiles qui dit clairement qu'on a besoin d'un programme qui couvre tout le monde. Et oui, mais n'importe les propos de Québec solidaire, on parle de les gens au Québec. Et la réalité, c'est le système qui était avant-gardiste dans le passé, un système hybride au Québec, c'est maintenant un système qui coûte trop cher. Ça coûte trop cher pour les gens qui doivent payer pour une couverture privée. Ça coûte trop cher pour les gens qui gagnent un salaire minimum. C'est une grande partie de leur salaire qui va à une assurance médicaments. Donc, ce qu'on propose, c'est un programme qui va aider tout le monde. C'est le demande des travailleurs. Oui, c'est clairement un parti progressiste, mais ça ne change pas la réalité que les syndicats, la coalition des gens qui travaillent pour militer en faveur de la santé, les gens qui disent que ça coûte trop cher pour nous de payer pour un système privé, ils demandent un système qui est meilleur. Et ça, c'est un système qui couvre tout le monde, un système qui est entièrement universel et public. Et c'est meilleur quand on travaille ensemble en utilisant la puissance de tous les gens à travers le pays pour acheter les médicaments moins chers, pour livrer l'aide à tout le monde.
The committee study on pharmacare basically showed there's a lot of confusion on the issue of single payer. The health minister is very clear that people will be able to stay on their private plans. You guys wanted single payer. How is the single payer if private plans are still a factor?
Well, the first step right now is covering free birth control and diabetes medication and devices. And the legislation lays out a foundation for us to move forward with universal health care or universal pharmacare. We believe fundamentally, if you look at the evidence around the world, that the best way to deliver the most affordable medication is a universal and single payer system. And we've included that language in the bill. And it is clear that that is the best way to move forward. For us, it's about what do we do to make sure our healthcare system works the best? How do we give people the best prices? And negotiating with the buying power of 40 million Canadians and negotiating prices that are the best for Canadians is in their interest. It'll lower costs for people, lower costs for provinces, improve healthcare outcomes, and that's what we want.
So are you saying you're accepting the private plans as long as it's temporary, as long as it's the beginning of the plan? Like, you seem to be accepting this.
No, not at all. We believe in a universal single-payer program, and we included that language in the bill. This bill isn't perfect, but this bill does lay the foundation. And we believe fundamentally in a program that is for people, not for big pharma, a program that's going to save money for our provinces, for our healthcare system, and improve the lives and health of all Canadians. That's what we're fighting for, and we'll continue to fight for that.
5 years ago, there was a report of the murdered and missing Indigenous woman that was established this morning. The First Nation Assembly of First Nation Chiefs said that only 2 of the 231 calls for justice were implemented in 5 years, and they're saying that the government failed them. So what is your reaction to 5 years on, not much progress has been done?
I support the claim that the government, the Liberals, have failed Indigenous women and girls on this front. It's heartbreaking. 5 years later, after a clear set of guidelines and calls for justice were laid out, clear steps that could be taken that could save lives, and the government's failed to implement. We've pushed them, and they continue to show a lack of urgency. We've been able to get a pilot project in Manitoba through the great work of Leah Gazan to fight for a red dress alert that will specifically help women and girls that are missing. This is an important step, but clearly so much more work needs to be done. On the 5-year anniversary, we call out the government's inaction, and we'll continue to fight for real steps to be taken.
What else are you pushing the federal government on then? You said that you pushed for the red dress alert. What else?
In our agreement, we pushed for 2 pieces. One, a table to be set to work with provincial partners on implementing steps. We also called for a federal plan in terms of the implementation. It's not enough to just have the calls for justice. We also want to see a plan to implement it. So we pushed for that in our agreement. The Liberals have again showed a lack of urgency and a lack of response to these really important demands.
Thank you.
Merci. Thank you so much. Thank you, everybody. Thank you.